The trial on Cobimetinib and Vemurafenib was very much the same as the other trial on Dabrafenib and Trametinib. So the question was the same. Scientific question was, is the dual inhibition of crucial molecules of the so-called, signal transduction pathway, is the dual inhibition better than just knocking one of the molecules out? And yes, the answer is yes. It's more or less the same result as for Dabrafenib and Trametinib. So response rate in a range of 70%, response duration 13 months, and then it came up that the 2-year survival is very promising. The 3-year survival data are not available yet, but we hope that they will be presented at another meeting in 2 months from now in Boston. So the tolerability is also very much the same. So, there is 10, 12, 13% of patients who need to discontinue because they have serious adverse events, but the other patients can make it to a long-term treatment. And also it's very interesting that there is some patients without any progressive disease after 3 years. For both clinical trials, there was subgroup analysis, which I presented, and I think this is the most important finding. So the subgroup analysis indicates that a simple serum marker like LDH, standing for lactate dehydrogenase, LDH is a very good prognostic marker, but on the other hand, a predictive marker for treatment outcome. So lower the LDH is, which means in normal limits, the better the outcome of the patient is, the higher the likelihood to respond from the drugs. And the worst patients are those who have LDH, which is twice elevated or even more upper the institutional limits. Still, they have really a bad prognosis with low median overall survival and particularly a low chance for 3-year survival. So there is a very high medical need remaining for patients with high LDH levels at baseline when we initiate the treatment.